again. This is our last presentation of the season, and then we'll resume again in September. So we're thrilled to have two presenters with us today, two of our students, and Salma is going to go first. Yeah. I'll turn it over to you, Salma. Thank you.
Hi, everyone. Thank you very much for coming today. I'll be presenting today about advanced practice nursing roles in Arab country in Eastern Mediterranean region, a scoping review. And in my presentation today, I will start by giving you a little brief, hopefully it will be brief, background info about advanced practice nursing role, when and why they have been emerged, the current status of advanced practice nursing role globally, a little bit about Arab countries in Eastern Mediterranean region, and then I'll talk about the scoping review, its goals and objectives, and the methodology used, and then we'll talk, inshallah, more and more about the results of the scoping review. So who are advanced practice nurses? ICN, International Council of Nurses, established a definition for advanced practice nurses in 2009 with an update in 2020. And it defined an advanced practice nurse as a generalist or a specialized nurse who has acquired through additional graduate education a minimum of master's degree, the expert knowledge base, complex decision-making skills, and clinical competencies for advanced nursing practice, the characteristics of which are shaped by the context in which they are credentialed to practice. And to further differentiate advanced practice nurses from other specialized and generalist nurses, ICN developed three main characteristics for advanced practice nursing role, and they are graduate education. So all master's prepared nurses should be prepared at a minimum of master's education from well-recognized and accredited master's program, and their practice should be with an extended level of autonomy and capacity to handle complex cases. And then they should also have some regulatory mechanism, which is country-specific. And this might include like title protection, or have the authority to prescribe medications, or the lab test, or even refer patients to other healthcare providers, or even admit them to the hospital. The first advanced practice nursing role was formally recognized in the United States in 1950s, was clinical nurse specialist to meet the specialty needs. But now advanced nursing practice role are practiced all over the world, and there are many driving forces that have driven the need for APN's role, including primary care reform, escalating healthcare costs, aging population, the need for enhanced health promotion, chronic disease management and prevention, and health workforce shortage. The two most common practice APN roles are clinical nurse specialist and nurse practitioner, and we have different types again of APN roles. And now more than 78 countries all over the world have APN roles in different healthcare settings, including primary care, inpatient, ambulatory, and long-term care. And many systematic reviews evaluated the impact of care provided by advanced practice nurses, and evidence continues to demonstrate positive outcomes with the care provided by these nurses. So, and systematic reviews done with geriatric population or children and youth both demonstrated high patient satisfaction with significant reduction in readmission rate. Another systematic review also was done examining the impact of integrating NPs in emergency and critical care department, and also positive outcomes were noted, including improved patient satisfaction, reduced length of hospital stay, reduced immortality, reduced time for consultation and treatment, and also the care was more cost saving. Yes, APN's role vary significantly among countries, so each country is different, so we have a lot of variations in terms of APN role title, educational preparation, scope of practice, and regulations. And this have led to a lot of confusion about advanced practice nursing role, and even some scholars claim that this might in some way slow the full utilization of advanced practice nurses. So among the countries that implement advanced practice nurse role are Arab country in Eastern Mediterranean region. Some of them, they implement advanced practice nursing role. And we have around 19 Arab country in Eastern Mediterranean region. And they are Bahrain, Djibouti, Egypt, Iraq, Jordan, Kuwait, Lebanon, Libya, Morocco, Oman, Palestine, Qatar, Saudi Arabia, Somalia, Sudan, Syria, Tunisia, and United Arab Emirates, and Yemen. So all these 19 countries form what is known as Arab League, and Arabic is the main and formal language spoken in this country. And these countries also share the same land, the same religion, the same culture, and even the healthcare system are almost similar. Was the evidence from these Arab countries summarized or synthesized or mapped? The answer is no. And this is why we decided to do this scoping review to map and summarize any evidence related to advanced practice nursing role in Arab country in Eastern Mediterranean region. And we use JPI as a methodology for scoping review to guide this scoping review. And for the inclusion criteria, we considered all sources that include advanced practice nurses, like clinical specialists and nurse practitioner. And we used ICN definition for advanced practice nurses to guide the inclusion criteria for the participant. Regarding the concept, we considered any evidence related to advanced practice nursing role, and these evidence could be about the historical development of the role, the title used, the education preparation for the nurses, the scope of practice, regulations, facilitator and barrier for role implementation, and role outcomes. The context, for sure, we include any evidence that include any data about Arab country in Eastern Mediterranean region. Sorry, we consider all types of evidence, including both quantitative and qualitative data sources, text and opinion, policy documents, systematic reviews, and books. We developed research strategies that aim to locate both published and unpublished sources. So we searched different databases such as CINAHL, PubMed, PsycInfo, Embase, Nursing and Allied Health, and Scopus. And for unpublished studies and career literature, we searched Google Scholar, ProQuest thesis and dissertation database, International Council of Nursing, World Health Organization, regional office for the Eastern Mediterranean website, and also we searched websites of Nursing Association and Ministries of Health in Arab countries. The date of search were from the inception of the database until 22nd of June 2020, and we include those published in Arabic and English. We didn't apply any language filter when we did the search, but then we exclude them. And I think there were around 20 non-Arabic or English sources, and the majority were written in French or Spanish. So the initial search yielded around 5,398 sources, and also we identify additional 44 sources from the grey literature. So after removing the duplicate, we screened 3,277 for title and abstract, in which 3,030 were excluded, and 239 were screened for full text. 205 sources were excluded, and I think 63 were excluded because they were not about advanced practice nursing role, and around 163 because they were not conducted or about Arab country. We excluded 5 sources because we were not able to allocate the full text. 2 because they were, I think, a book review, so we exclude them. So we ended up with 34 sources included in our review. So regarding the characteristic of these 34 studies that included in our review, all of them were published between 1995 to 2020, in which 68% were published after 2010. And the Arab country that included in this study were Saudi Arabia, with 9 articles including data from Saudi Arabia, 7 articles included data about Oman and Jordan, 4 about UAE. We have also 2 articles about or include data about Qatar, Palestine, Bahrain, Tunisia, and Sudan. And we have some international literature that include, different country all over the world, and they include 1 or 2 country from Arab, 1 or 2 Arab country. We have 5 of them. And regarding the types of literature included, 10 were primary research papers, 5 were qualitative, and 5 were quantitative. And 3 of these 10 were PhD dissertations, and all these 3 used qualitative research design. The rest of the literature were non-empirical research papers, in which 8 were journal articles, 6 were commentaries, 1 review paper, 1 organizational report, and 1 book chapter. And we included also 6 from organizational websites. Regarding the participants in the included study, 5 of the included study included both advanced practice nurses with other healthcare provider, like advanced practice nurses with staff nurse or nurse educator or physician. And only 1 study include nurse anesthetist, and 1 study were about nurse midwife, and 1 only include primary care physician. And 2 of the included study just include patients as a study participant. Regarding the gender and the age of the participant, unfortunately, only 1 study reported the gender and the age of advanced practice nurses, wherein 88% were female, and their age ranged between 24 and 33 years. I think this is the interesting part. So the evidence we found, we mapped them or we grouped them under certain themes. I think there are 1, 2, 3, 4, 5, 7 themes. They are the first theme were about ABN role development, and the entitled use, education preparation, regulation, and scope of practice, facilitator and barriers of the role implementation, frameworks used to guide the ABN development, and ABN role outcomes. So in my presentation today, I will focus on the first 5 just because of the time. So regarding the advanced practice nursing role development, I think it's still in its infancy in most of the Arab countries in the Eastern Mediterranean region, and can be described as slow but steady and still evolving. So as you can see, the majority, only 5 Arab countries in Eastern Mediterranean region have implemented different types of advanced practice nursing, and the majority of them implemented the role after 2000. I think one of the interesting findings from this review is that Saudi Arabia and Palestine, the ministries of health in Saudi Arabia and Palestine still did not recognize advanced practice nursing role as a professional role. So actually, advanced practice nursing role in these 2 countries were implemented in only 1 hospital, not in many hospitals. So it's just within that hospital, and even the regulations, everything is just within that hospital. Other countries, started to take some steps toward integrating ABN. So some countries start to write the definition and the scope of practice about advanced practice nursing role, like United Arab Emirates, Lebanon, and Bahrain. They have written definition and scope of practice, but still not yet approved. But at least they took some steps. And some countries like Egypt and Tunisia, they have neither written nor approved definition for ABNs. And we don't know anything about the other countries because there was no any published information. So some of the main driving forces for developing and implementing advanced practice nursing role in Arab countries include shortage of physicians, both in number and specialties, the emergence of non-communicable and chronic diseases due to lifestyle changes, desire to have more cost-effective primary care, globalization, increased use of technology, and to improve the image of nursing as a profession. And also some countries like Oman and Palestine and Saudi Arabia, there were nurses who practice with extended role without having proper education and training, so as a way to protect the public and to increase the quality of these nurses, advanced practice nursing role were implemented. This is not really a fancy map, but it summarized the current status of ABN in Arab country. So those with pink color are those country where advanced practice nursing role were implemented. Those with green, I think 2 or 3 countries, they have written definition and scope of practice, but it's not yet approved. And those with orange, they don't have written neither nor approved definition or scope of practice. And those with the gray, I think many countries, we don't have any data about ABN from this country. But I think that doesn't mean that ABN does not exist in this country. Maybe we just don't have access to the document. Regarding the title used for ABN, the common use title were nurse practitioner and clinical nurse specialist. And we have another title we found it from Jordan, which is clinical nurse coordinator. Oman is the only country that commented title protection for nurse practitioner role, but clinical nurse specialist is not yet protected in Oman. And we don't find any information regarding the title of protection from other Arab countries. Regarding the education and preparation for advanced practice nurses, most Arab countries like Oman, Bahrain, Jordan, Lebanon, Qatar, and Saudi Arabia proposed a Master of Science in Nursing with a clinical focus as an entry-level education for advanced practice nurses, especially for nurse practitioners. In Oman, for example, the entry-level education for clinical nurse specialists is not yet defined. And still some countries like Saudi Arabia, even Palestine and Jordan have like 1 year in-house training to prepare nurses to work as advanced practice nurses. And most of these training programs are led by physicians. Entry-level education for advanced practice nurses role was not yet defined in Tunisia, Egypt, and United Arab Emirates. We also scoped the university in Arab country that provide master's degree, and there are some countries that provide masters in nursing, and they documented their goals as to prepare nurses to be advanced practice nurses. But unfortunately, these programs are not very clear. It's not clear what type of roles these nurses will do after their graduation, whether they will be working as clinical nurse specialists or they will be working as NPs. Regarding regulations and scope of practice, variations also noted among Arab countries. Only 2 countries currently regulate ABN roles, and these are Qatar and Jordan. Oman is still in the process of regulating the NP's role. There's no regulation for clinical nurse specialists in Oman. For Saudi Arabia and Palestine, as I said, because the Ministry of Health still didn't recognize advanced practice nursing role as professional role, they have regulation within that hospital who implemented the role, but there is no national level regulations. Oman, Qatar, Jordan, the scope of practice have been written and approved at the national level. In United Arab Emirates, Bahrain, and Lebanon, they have written scope of practice, but still it's not approved yet. So it's in the process of approving. And regarding the scope of practice, Oman was the only country that authorized nurse practitioners to prescribe a predefined set of medications. And advanced practice nurses in Oman, Qatar, Palestine could refer patients to physicians and other healthcare professionals within their organization, while advanced practice nurses from Saudi Arabia, they cannot refer patients to other healthcare providers, to physicians, I mean. They can refer patients to other ancillary healthcare providers, but not physician. A clinical nurse specialist in Saudi Arabia and ophthalmic nurse practitioner in Palestine have the authority to order laboratory tests, while MPs in Saudi Arabia, they cannot order laboratory tests. So a lot of confusion what they can do and what they cannot do. Clinical nurse coordinators in Jordan also, they don't have the authority to assist, diagnose, or treat patients. And I think the main goal of advanced practice nurses in Arab country is to provide holistic patient care. We didn't find any papers about the certification, licensure, and the credential requirement for advanced practice nurses. I think developing and implementing advanced practice nursing role in Arab countries was really, or is really complex. There are many structural barriers that hinder or slow the development of advanced practice nursing role, including lack of clear definition, recognition for ABN's role by ministries of health, physicians, patients, and other healthcare providers. I know that I mentioned before some countries have established the definition, but actually we didn't find these definitions. So when we did the scoping review, we don't know what's come under the umbrella of advanced practice nurse, whether just clinical nurse specialist and nurse practitioner or nurse midwives, for example, also considered as advanced practice nurses, because there was no clear definition published. The other structural barriers include role ambiguity, lack of clear job description, lack of regulations and legislations, also shortage of national nurses, and lack of proper education at the national level. Interestingly, most of the advanced practice nurses are expectorate. This is why most of the country, they delayed in implementing advanced practice nurses role. So the first Omani nurse practitioner joined the service in 2016, and also the first Saudi nurse practitioner joined the service in 2016. And I think one of the reasons is lack of proper education and training at the national level. Lack of competitive financial incentive, and also lack of political stability, especially in Palestine, also documented as structural barriers. We have a lot of cultural barriers, and this include low status or image of nursing, the stereotype that nursing is a female dominant profession, and the suicidal belief about the subordination of women to men. So we have a lot of men physicians who like to control everything. Lack of respect for clinical nursing compared with nursing administration and education, and again, lack of involvement and representation of nurses in policy and decision making. Also, we found some facilitator that foster or push for implementation of advanced practice nurses. One of them are service demand, because we have now a lot of non-communicable diseases. So they want to increase the health promotion among population. And also hospital mission to achieve international accreditation. I think this is really interesting findings, because to achieve international accreditation, they have to provide research, teaching, and patient-centered care. So advanced practice nurses were viewed as a way to achieve this international accreditation. Support and advocacy from physicians and nurse managers to introduce advanced practice nurses. And I think this one of the interesting findings, because some physicians, they resist, they don't want nurses to be as a leader and to have autonomous role, while other physicians push to introduce advanced practice nurses. And the difference between these two groups is that physicians who receive their training overseas in UK, US, or Canada, they know about advanced practice nurses and what they can do. They push for the introduction of advanced practice nursing role in the hospital. While those who don't have experience working with advanced practice nurses before, they resist the development or the integration of advanced practice nurses. Other facilitators include involvement of nurses for sure in the policy and decision making, and also the characteristics of advanced practice nurses, like their knowledge, their training, and their motivation. In conclusion, I know there is a growing interest regarding advanced practice nurses' role in Arab country in Eastern Mediterranean region, and that was evidenced by steadily increasing number of publications since 2010. However, all the evidence I presented were from only 7 countries, mainly Oman, Saudi Arabia, Qatar, Bahrain, Jordan, Palestine, and United Arab Emirates. I think there are some initiatives done already in other Arab countries, but they are not published. So I think it's very important for this country to publish more about advanced practice nursing. Variations, again, noted in the title, in the education preparation, and in the regulations among Arab countries. And I think this is normal because we have a lot of variations also noted globally. And most of the reported barriers and facilitator from Arab country also reported elsewhere. So I think it's very important to have proper structures, including clear definition, education preparation, regulation, to really support the development of advanced practice nursing role in Arab country. And nursing as a profession also need to be empowered, and nurses need to be more involved in policy and decision making. And I think we need also to form a council or association that gather advanced practice nurses so they can have a dialogue and discuss their experience and the challenge they face. More attention need to be given from international organizations such as the WHO and ICN to really support the development of advanced practice nursing in Arab country. I think the good point is that we identify some areas that's needed for future research, and I think we need more research to explore the lived experience of advanced practice nurses and those who work with them, because according to the literature we included in our scoping review, only 2, and both of them were PhD dissertation that include advanced practice nurses. And also we need more rigorous research to evaluate the impact of advanced practice nurses. One limitation of the scoping review is that they didn't include any
within a half hour.
Oh yeah,
yeah.
That is the first one. Yes. Yeah. So thank you for your time. I know. It takes long time. Yeah.
Great. Thank you so much, Salma. We have a couple of minutes for our audience to ask questions and provide comments.
Yeah, please.
So I'll put it out to the audience.
Yeah, sorry I took long time.
That's okay. We've got a few minutes. Oh, Keisha, your hand up.
Oh, yeah, sorry, I should have just unmuted myself. My apologies. Salma, this was amazing. I just love your project. This has really come together nicely. So I do have 2 questions that I'll just say together quickly. So the first one is just around the language restrictions and the justification for the restrictions to Arabic and English. Because you mentioned that out of like the 19 EMR countries, only 7, like the sources came from predominantly 7. So I'm wondering if the restrictions, and I'm thinking, mostly of say French and Spanish, played into that. So that's the first question. And then the second is just really around the process that you used to, I guess, conceptualize your findings and how you decided to present them as the themes that they were. Because as we know, like scoping reviews and presenting findings, that's a lot of work. So I'm very interested to hear this.
Yes. So yeah, thank you very much, Keisha. So regarding the language restrictions, I think most of the Arab countries speak Arabic, and some for sure they might publish their article in English. Regarding the French and the Spanish, most of these articles we identify them actually before when we did the full text review. I mean, when we did the title and abstract screening, we identify actually some. I think 1 or 2 of these French were from Tunisia, because as you know, Tunisia, I think they really speak French. So there were 1 or 2 articles published in French. But what I did is that I contacted actually the author of these articles, and I asked them about the content of the article, and they told me, for example, no, like nothing about advanced practice in these countries. So as I told you, we didn't apply the language restriction when we applied the search. We just identified them later. I think the mistake we did, we have someone in the team who knows French, but I don't know why I didn't consider that in the beginning. I just looked to the language later when I was writing the report. And then I noticed that we have somebody who have experience in French, but we didn't use them. Anyway, none of these articles were about advanced practice nurses.
Right, that makes sense. So my mind automatically went to the French that it was included in the EMR, but yeah, that makes perfect sense.
Yeah. And also regarding the themes, it's according to what I did is first, through my literature review, I know about the previous research, what areas they focus on when they write a systematic review or scoping review about advanced practice. So I have like some preliminary ideas about some of the expected themes, like about development, title, regulation, scope of practice, and these. And also this was really prominent from the literature that we extract. And any additional data, I think there was some about framework. We didn't propose to use, to extract data about frameworks, but because the scoping review questions really open, we identified some studies that really talk about the framework that used to develop or to implement advanced practice nursing role. So we include it also, and we put it under one theme. So the answer is that we have some preliminary ideas about the expected theme, and we steam that from the existing literature, but still we were mindful to the literature that we identified during our data extraction.
Thank you.
Great. Thank you so much, Salma. Excellent presentation. And as Keisha said, like, a lot of work. So it's very helpful for all of us to hear what you've done, how you've done it, and just gather all this information. So we really appreciate it. Thank you. So we will turn it over to our next presenter, to Labiba. So I'll get you to unshare your screen, Salma, and then
Hi, everybody. I'm just gonna share my screen here.
great. Great. Thank you. So we'll just turn it over to you, Labiba, and let you go.
Awesome. Okay. Let me just put this here. Oh. So, hi everybody. My name is Labiba. I'm a third semester nursing student. Today I'll be talking about discrimination against healthcare workers in the healthcare setting. I've honed my topic a lot as I was doing research, so I hope you don't mind me kind of talking about a specific subject. Okay, let's get started. So most of us, when we think about discrimination, first thing that comes to mind is racial discrimination. But what we need to realize is that there's a lot more, there are many kinds, such as age discrimination, disability discrimination, sexual orientation, which I will touch on a lot today, just because I think it's not talked about enough, and it's one of it's like a leading case in discrimination issues. There's also discrimination in terms of status as a parent, religious discrimination, national origin, pregnancy, sexual harassment, race, color, and sex, and reprisal and retaliation, which some of us may be unfamiliar with. Retaliation can be a form of discrimination or an adverse action that is made against an employee who files a charge or participates in an investigation. So kind of like discrimination against a complaint filed by someone. So I just want to talk a a little bit about, or not a little bit, a lot about sexual orientation. So for example, a trans person is more likely to be the victim of a hate crime than being heterosexual. Due to the high levels of discrimination and violence that they face, many trans individuals are at risk of internalized transphobia. Transgender refers to people who are born with a gender identity that is different from their assigned sex at birth. It also includes those who do not identify with or accept the traditional notions of gender. I'm just going through some definitions that are most commonly used in today's society. The small number of individuals of the transgender population can be a challenge to study properly. This is also a case for stats analyses. In 2015 and 2014, the International Labour Organization carried out 2 studies in Argentina. And I'm going to be talking a little bit about like international context as well, just to get an idea of what's happening other than what's happening here in Canada or Nova Scotia. The second study, which was conducted in 2015, analyzed the attitudes and behaviors of gays and lesbians at work. The significance of sexual orientation, gender, and gender expression in the workplace is often overlooked. This issue is also linked to the processes related to discrimination, violence, and inequality. Anticipated stigma is a type of stigma that refers to the idea that people with certain characteristics may be treated differently simply due to their perceived traits. This kind of stigma is also known as anticipated discrimination. Many of those with different sexual orientation experience this kind of discrimination. The data also shows that various aspects of sexual orientation can be concealed. For example, marital status can be considered an issue for some individuals. Various factors such as sexual orientation, gender, marital status, and social class belonging can create specific conditions of discrimination and inequality during the selection process when you're applying to a job. Furthermore, some testimonies revealed that sexual orientation was perceived a hindrance to obtain a promotion. For example, a gay nurse witnessed how one of his colleagues who was gay was not respected as a supervisor due to sexual orientation. This reinforced his perception of anticipated stigma on the impossibility of obtaining a promotion. This means that sexual orientation or gender expression might be a hindrance linked to the visibility or individuals' discretion in workplaces based on the strategies of personal information management. So kind of touching on like how much the employee reveals about themselves personally. It's important to remember that many of some of the interviewees that do not, like from studies that do not perceive sexual orientation as hindrance, they prefer to keep their private life separate from their professional life, as if both were different dimensions that are not related at all. Moreover, it's reasonable to wonder if gays and lesbians, and the specific study concentrated on gays and lesbians, so if they can obtain a promotion and under what conditions could they get it. For instance, this chief of surgery said that he did not think of sexual orientation or gender expression as a hindrance at his workplace. However, he could not communicate directly with other chiefs since they avoided him due to his sexual orientation. This case could be considered an example of denial as a strategy, not necessarily on purpose, to face discrimination and stigma in his workplace because of his colleagues' avoidance in the absence of direct verbal communication. I believe I kind of switched my points here. I talked about the second one before the first, but I will get to the first very soon. I apologize for that. With no intention of assuming or forcing an interpretation, it's possible to affirm that This denial strategy is a coping mechanism to minimize the cognitive and emotional attachments, which leads to recognize thoroughly that the interviewee's sexual orientation and gender expression has negative effects on labor organization and social relationships with his coworkers. Somewhat denial would make discrimination more tolerable at the subject's workplace, but that doesn't necessarily mean that it's the right way to go about things. Otherwise, it may lead to confrontation with his colleagues, transferring to another place, or even quitting. This demonstrates the mental burdens that facing discrimination at the workplace causes, which literature has analyzed as minority stress. Additionally, it was found that the relative visibility of the chiefs softened the negative perceptions upon the potential barriers that being gay or lesbian involves. So this also demonstrates the importance of positive views expressed by those in higher positions, and the importance of sexual diversity visibility in the construction of more diverse, or at least less discriminating organizational cultures. More visibility favors the naturalization of experiences, practices, and patterns that are out of the heteronormative model. Another variable for this specific investigation is the genderized medical specializations, which is important to analyze sexual orientation and gender expression as potential hindrances to get a job or a promotion. Gendering of medical specialties is how the workers are distributed in different specialties based on their gender and sexual orientation. So for example, as general surgery, orthopedic surgery, urology, and cardiology are considered more misogynistic specialties since there are more men in these specialties. Pediatrics, dermatology, clinical laboratory, and nursing are more female specialties in which there are more gays and lesbians. As a matter of fact, this medical specialty division based on gender and sexual orientation demonstrates how sexual labor division is actually reproduced in the health system and the labor market. And in a testimony, however, a lesbian physician says that she used to think that her sexual orientation could be an obstacle, but it was her issue. However, she does not think this way anymore since no one told her anything concerning her sexual orientation at her workplace, which is the hospital. The expression "my issue" is recurrent in the interviews and signals that the internalized heterosexism and the anticipated stigma are closely related. The interviewee rather not think of her sexual orientation as a hindrance because no one told her anything at the hospital. However, she also mentioned that she had a meeting with her superior due to a rumor about her relationship with another resident, which caused her plenty of difficulties. In the same way, another lesbian nurse stated that she did not feel confident to say she is my girlfriend because she feared her colleagues' rejection. So that's again anticipated stigma or discrimination, since she had already suffered her family's rejection when she came out. This is an example that shows the connection between the coming out, the enacted stigma, and the effects of anticipation on her further professional growth. Additionally, another lesbian physician used to believe that she would not obtain a promotion if someone were to know she was lesbian. She also admitted a positive change since nowadays there is the possibility of making a complaint. This would strengthen the assumption that in the last years, because of the complaints, gays and lesbians have gained a growing legitimacy and the feeling of an increased participation due to authorities to report discriminatory abuses. Despite these legal improvements, plenty of pro-LGBT civil organizations demand a new national bill against discrimination, which should repeal the current act and include sexual orientation, gender expression, and gender identity as specific pretexts of discrimination. Sexual orientation, however, is still considered a potential hindrance in workplaces that are either faith-based or secular. Another nurse who works at a private hospital said that sexual orientation might be a hindrance when attending patients due to the physical contact. So patients could request professional attention from another employee if they knew that she is a lesbian. This episode of enacted discrimination was actually what another interviewed gay nurse suffered himself in a private health institution. A patient did not want to be assisted by a gay nurse, so they requested another nurse to attend to him. The gay nurse thought the patient made the request because of his sexual orientation and or his gender expression, and his superior granted the patient's request, and another nurse replaced him. This testimony, as many others, shows one of the specificities that occur at health workplaces. The body dimension becomes more relevant due to the greater degree of exposure between professionals and patients compared to other jobs or social life contexts. And I think it's important to note the superior's action in response to the situation. It can be hard to deny a patient's request, as that's their happiness is, one of our it's really important to us, but it can be, I believe there should be some policy regarding the refusal of treatment from a certain individual, because overall it's just not right, and it may allow the patient to think that it is. So going back to my first point, the magnitude construct, especially the dimension centrality, is useful to comprehend why sexual orientation is not perceived as a hindrance in some cases. This means that when there is absence of anticipated discrimination perceptions, hence in the testimony of a nurse and a physician, the fact of being gay or lesbian is secondary, since work and academic performance would be pivotal for healthcare organizations. Based on these testimonies, it's possible to infer an extended strategy for some of the interviewees, which consists in separating the professional sphere from the private sphere. To handle risks, dividing the world into two parts, which is a quote by Goffman, between those people who are not told anything and those who are trusted to share private life details. Thus, information and mechanics remain separated or split to avoid potential conflicts. Testimonies I've read demonstrate that even though perceptions of anticipated stigma are common and widespread among gays and lesbians at their workplaces and their lives in general, they do not affect all of them equally. Quotations are commonly printed as a means of inspiration and to invoke philosophical thoughts from the reader. So I just wanted to include this quote, but I couldn't find the source or who said it. But it's judge me as a professional for what I know, for what I studied, for my job performance. The current public health crisis, in a recent correspondence, the authors have rightly expressed the need to prioritize our frontline healthcare workers, since they're at the top of the list to be infected because of their exposures to patients. They have been deprived of fair salaries, proper training, personal protective equipment. And, I've seen that secondhand, I would say, just because, my mom works in the hospital and she's mentioned how they don't have proper PPE all the time. And they also experience psychological and emotional interventions. I apologize if you hear talking in the background. I forgot to tell people in my house that I'm doing a presentation. Studies have shown that front healthcare workers have been victims of stigma and discrimination. In the Philippines, for example, reports of frontline healthcare workers being attacked became news and trending topic in the social media, with many experiencing eviction, ridicule, and harassment, even within their workplace and boarding houses. During the current COVID-19 pandemic, several forms of stigma and discrimination have been reported worldwide, mainly toward Asian descent, those with international travel history, and frontline healthcare workers. I think when we think about discrimination in this pandemic, we mainly think about situations involving individuals from Asian descent. So it's surprising to know that healthcare workers, at least on the front line, experience this as well. So what's been going on to combat these issues? In December 2008, the US Department of Health and Human Services issued a final regulation that prohibits discrimination against healthcare professionals based on their religious beliefs. Professional, psychosocial, and psychological support must be available to all stigmatized individuals, including frontline healthcare workers. Indeed, our frontliners were considered wounded healers because they also need to take care of themselves. In response to the situation of stigmatization and discrimination against frontline healthcare workers, the author proposes, from a journal I've read, several ways on how the public and the Philippine government might create safety guidelines by revisiting the international and local laws, freedom from discrimination as stipulated in the Universal Declaration of Human Rights and enshrined in the 1987 Philippine Constitution, states that all individuals are entitled to human rights without distinction of any kind, such as race, color, sex, language, religion, political or other opinion, national or social origin, property, birth, or other status. The anti-discriminatory provisions of the statutory laws, including Article 9 of the Magna Carta of Public Healthcare Workers, are in effect. Several laws and ordinances have been implemented, such as the Anti-COVID-19 Discrimination Ordinance of 2020 in Metro Manila prohibits any form of harassment or discrimination against the above mentioned persons, as well as government forces in the front lines. As a result, stigma and discrimination or harm against frontline healthcare workers and patients suspected of having COVID-19 are now prohibited in all 17 cities and municipalities in Metro Manila. And then there's also the Canadian Human Rights Act, which states a person who is guilty of an offense under subsection 1 is liable on summary conviction to a fine not exceeding $50,000. So at the end of the day, what is evaluated as intellectual and practical? All that matters is knowledge, and healthcare is what really matters. Thank you for your attention. That's just my email there if you have any questions or you want to continue this discussion, I'd be more than happy to do that. And that's just what I used for this presentation if you're interested on spicing up your PowerPoint.
Great. Fantastic. Thank you so much for your presentation, Labiba. A lot of information, and obviously you've done a lot of literature reviewing and critiquing and just pulling it all together for us. So we really appreciate it. I'll put it out to the audience. We have 5 minutes for questions, comments, dialogue. Feel free to jump in, anybody. And if you don't have your audio, you can type things in the chat space.
It was a lot of information, so I understand if, it takes a while to kind of sink in. But again, if you do have further questions, in the future, my email is actually it disappeared. But
just wondering where this work came from. Discrimination, as you started, there's so many complexities, and so where do you start? And you gave really wonderful focus thinking about LGBTQ. And I think what I always find really powerful are those stories. So it looks like you found some of the literature that told those stories and really getting to the nuances and what's going on and the power dynamics. I guess that's what I found really interesting.
Right. I think personal stories are so important just because like we read so much of like research and not a lot of it includes personal stories. So I think that firsthand experience reading about those is really important.
Yeah. Oh, I see your hand, Keisha. Go ahead.
Hi, yeah, thank you, Labiba. That was a great presentation. I just had a question going back to when you were talking about, I guess, male nurses, and it brings me back to like my clinical experience. And I'm just curious because you mentioned policies and having to do better in terms of, you know, addressing patients who are discriminatory towards nurses. So I wonder about, you know, your views on nursing education, because in my clinical experience, I recall being, you know, in a group with, you know, other male nurses, and they were almost like educated and told to ask whether or not, say, a maternity patient would be comfortable having a male patient. Yeah, so I'm curious kind of your thoughts and views around, you know, do we educate, you know, nursing students and nurses to, I guess, cater to patients, or how do we work around that?
That's a really good question. I think that would be a different. It's a little gray. It's a little bit of a gray area, but and personally, I think it'd be a little different just because we're talking more about gender comfortability. That's a word, which is, you know, I think that's why we have different changing rooms for girls and guys. I think it's I think yeah, that's a different topic. And just because what I touched upon was like, I believe personally just a wrong moral to refuse assistance from someone who is of different sexual orientation than you, or of an orientation that you don't prefer. But yeah, definitely, I think it's okay in that sense for patients to refuse treatment. Just like I said, I think they're two different things, and I think definitely needs to be talked a lot about more. And I think it should definitely generate a lot more conversation with people in higher positions for sure. But I think in that context, it would be fine for me personally. And it's part of the policy, I guess, as well, or the education nurses receive. But yeah, they definitely be two different things.
Great. Okay, well, thank you. I see it is 1 o'clock. So you've raised all sorts of issues for us, Labiba, and which is wonderful. When we have more questions, then that'll push us to have these conversations, which are really important. So really appreciate that. So thank you to you. Thank you to Salma. Another great session and great way to end off the year. So we'll say goodbye, and I guess Julie, you'll click us out. Thanks.
Bye. Thank you.